Okay, let's look at this and figure out where is the skeleton? What's happening? What's the structure underneath all of this? Now, Scott's head is, it's pretty easy to see his skull. There's a pretty clear indication along the jawline. That's the mandible. Up to the teeth. Around the nose, there's a hole. Because all of that is cartilage. And then it goes up to this piece right here, the brow ridge that also forms the orbit. And the orbit's the piece of your skull where the eyeball fits. Kind of right in there. Now the upper piece of the skull has this bony structure right through here. Kind of has a corner right here. Forms the bottom of the orbit. And then comes back along here. That's called the zygomatic arch. Well, this part's called the arch. Actually, is pretty thin right through there. And this is the zygomatic bone. It's basically your cheekbone. We can see that. It's catching light in the drawing over here. It comes back and terminates behind the ear. Then there's what's called the temporal fossa. So it's indentation, which right about here in this drawing, you can feel it's your temple. It's that soft part you rub on when you have a headache. And then from the brow ridge, you get this bony structure, which is the rest of the cranium, coming up and around. Key thing to think about with that is that it's got a front plane and a side plane. You can see here that piece of light, that is the front plane of his cranium. You can see the brow ridge right through here. And then as soon as it goes into shadow, that's the side plane receding back away. And then we wrap around the back of the skull, back here. One of the key features here, you can feel this on your own skull, is right about here, the occipital protuberance. It's a little bump on the back of your skull, it sticks out the furthest. And then there's an indentation just below that, kind of a soft, squishy piece before you run into the vertebrae of your spine and the muscles of your neck. It's this little bump right here on the skull. How the jaw works with the teeth and everything. Teeth are a separate piece. Do their thing. And then there's this hole right here where the bottom jawbone, the mandible, breaks away from top. And then here, just before we get to this, there's another little piece like this. and you get the jawbone. And right behind that, right at the base of the skull, there's a hole as the skull comes around, and if you can kind of see, that's the ear hole. That's where sound gets in. Kind of give an indication here of the parts that you can see through, so some of the parts can kind of push forward in space a little bit for you. A little shadow in the nose. So basic structure there of the skull. We see a lot of bony structures when we're looking at somebody's face. And so when we talk about portraiture, I'll come back to this stuff about the skull for sure. But for now, that's enough to get you going with your drawing. The next thing that jumps out as the next landmark of skeleton is this piece right here. Comes up to a bump on the shoulder up here. It's called the acromion process. But this bone right here is the clavicle, or the collarbone. We can see this piece on most people. There's usually some play between light and shadow happening there, and the reason is you can see it right here. It's a little piece of it here, and it's coming off this way towards the shoulder. It's the clavicle. And this little indentation over here on this side is part of that as well. Those two meet the sternum, which has a bone kind of like a necktie, but all of this is that indentation at the base of your throat. You can see right here. And then the sternum is this bony plate, travels down the center of your chest, down to about here, and is where the ribs meet here at the bottom. So your breastplate here. The rib cage kind of wants to live a little bit behind here. First rib attaches up here. So it comes in below the clavicle. There. And then we know that the rib cage wants to end down here. If we think about that overall kind of egg shape, we know what shape that's going to take. We've talked about that throughout the semester. So it's coming down on this side to about here, and then cutting back in, going back and disappearing. And on this side, it's coming down kind of through here. And if we could see through his arms, it's doing this. So we've got ribs going this way, ribs coming across and up, ribs coming straight across, and ribs heading uphill from there. Get a little bit of shading just to let you be able to see through what's happening in there. Now this arm's going to block the ribcage over here, so I'm going to pull it away. But there's what his ribcage is doing in there. Of course, what's happening between here and there is his spine. This part of the spine is called the cervical spine. It's got 7 pieces, 1, 2, 3, 4, 5, 6, 7. And the most important one is number 7. It's right about here. is the boniest part of that piece of the spine. If you feel on the back, it's probably hidden in this drawing, but just below this corner right here. If you feel on the back of your neck, lean your head forward, a big bump that's back there is the 7th cervical. It's the most bony piece of the spine right there. It sticks out the furthest. And on most people you can see it, so it's very useful to pay attention to. Through here, spine's wrapping around, basically following the curve of the rib cage. And then in this section, it turns again. So where we can see it, here we go. That's the lumbar region. So right about here to about here, lumbar, cervical. And this is called the thoracic. This whole piece is called your thorax. So there's 7, 12, and 5. 7 up here, most important one is number 7. That's where that bump is. They all turn independent of each other up there. It can move back and forth, obviously. There's 12 in the thoracic. Makes sense because there's 12 ribs. So each vertebrae of the thoracic spine has a rib attached to it on one side, or 2, depending on how you're looking at it. And then the lumbar has 5, the lower part of the back, the small of your back, if you want to think of it that way. And it terminates in what's called the sacrum, which is this kind of triangular bone with some holes in it. Used to be independent vertebrae, but eventually through evolution, they fused themselves together and just became one piece. And that is down inside your pelvis. And basically forms that triangle at the top of the butt. So if you think of the butt crack, the gluteal fold, as the bottom of the triangle, right where it terminates. And it comes up and you find these 2 little indentations on the small of the back. And you're starting to see what the sacrum looks like. The other really important set of bones here is the pelvis. We talked early on about how to indicate the pelvis. Let me get these angles right. As a box in space. That's not right at all. Let's work from the side. There we go. So we got the general direction of the hips going this way and kind of coming across and doing this. The pelvis basically fits inside there. It's kind of a little more complex than that. Over here on the side plane, it wants to come up and create this arch. And then here it creates this little point. So this is called the iliac crest. This piece swooping upward and then disappearing into the back. And then a really important piece for us, this little piece right here. On this guy, it's kind of hidden because it's all inside a shadow, but it's basically right here. And if you can see the difference in light and dark right through here, it's because the pelvis is changing the direction of things. So the ASIS, or the anterior superior iliac spine, and then the pelvis comes around to the front. We have pubic symphysis. It's actually a little lower than that. And right about here. And then it goes away to this side. And we can't see it on this side because his belly jumps in front of it. But back in here, we've got the other ASIS, and then the hip bone going up, and the two coming together. So let me clean this up a little bit so you can see a little more clearly what it is I'm trying to draw for you. Sacrum comes down to a point, and then all of this actually kind of does these weird things in here. It ends in this socket right here, and then goes over and becomes the front. Huge portions of what's going on in the pelvis we can't see. We can certainly usually, almost always, see the top of it. Almost always we can see the ASIS. And then a lot of this stuff in here we can't really see too much. Now we can imagine where the pubic symphysis is because, well, that's where all of our adult bits happen. The rest of this other stuff we don't see so much at all. From there, if we go to the great trochanter, it's the femur is the bone of the thigh. In this case, it's kind of coming straight out at us. So there's a ball, and then a piece that sticks out from it becomes kind of your hip joint. And then the femur follows this. Oh, that's a little too extreme. There we go. Kind of curves forward. Gets wider at the end and has kind of a boxed off end to it. Back behind the kneecap. It's the thickest bone on the body. Carries the most muscle. One of the most painful things you could ever break because of all that. And actually one of the most dangerous because this is the femur. Running right through there is what's called the femoral artery for obvious reasons. And that thing carries a lot of blood. And so a lot of times when people break this bone, if they break it in two, they actually sever the femoral artery and then they bleed out before they can get anything done about their poor leg. All right. The lower leg, kind of boxy again. And then you can usually see, and we can kind of see here, that change in light and shadow is where the shin bone, the tibia, comes down. And it creates the ankle over on that side. The fibula hangs out right about here. So there's two bones to the lower leg, and it comes down and creates the ankle on this side. And they work together to support everything that's happening in the lower leg. You'll probably see just a little bit of the other side of it too. There's a ridge down the middle of this that I'm trying to indicate as well. And then you've got the tarsals that come away and create the bones of the toes. Metatarsals are the little ones that are actually your toes. These are the tarsals up here. And then the thing that causes your heel is this piece called the talus. It's almost like, well, to me it looks like a thumb, even though you already have your 5 toes out here. But it does create, and especially if you could see the inside edge, a talus creates that archway, the difference between the talus and the tarsals. Jump back up. The patella, it's kind of like pentagram shaped, and it's designed to float on top of both the femur and the tibia. It's independent, and so it depends on what the leg's doing as to where the patella will actually reveal itself. But you always see it. It's always skin stretched tight right over it. There. So, and the spine. There we go. So key landmarks in this, again. For the head, it's the brow ridge. It's the zygomatic arch that creates the orbit. It's the line of the mandible, and it's the point that creates the back corner of the skull, or the cranium. C7 right here, always visible as a landmark. The clavicle, always visible. Oh, I should include right underneath here, heading off this way and down, all of this happening back here is the scapula. This angularity that you see right here, he's actually, because his arm's pushed back, pushing his scapula back, and so it's jutting out a bit there. The sternum, the shape of the rib cage causing the shape of the overall chest, and then the AS, IS on both sides. Pubic symphysis is right around halfway point, and there's clear indications of where that happens. There's a bit of an indentation here at the hip where everything gathers in here, and then basically down here what we're dealing with, the way I like to look at it, is a box with a circle in front of it for the knee. A lot of times we can see the head of the fibula pushing out. There's a little bump right in here. Can't see it here because it's in shadow. And then the ankles are actually caused by the end of the tibia and the fibula. Go back up to the arm because I've forgotten all about it. Right up in here is the head of the humerus. It sits in this socket that's just below the acromion process, that bump at the shoulder. And then it's round at the top for the most part. As it comes down, it gets wide and flat, almost squares off. And it's usually divided into 3 pieces. What we're seeing here, this little angle right here, this cut in right here, and this happening here, that's all bone. It's not muscle, it's not fat, it's not skin, it's bone just below the skin revealing itself. And then from here on down, I lost my train of thought. The ulna, which is this bigger bone, and just like the lower leg, there's a secondary bone here. The radius is a smaller bone, and it does some strange things. Well, it rotates depending on what the arm's doing. And in this case, it's rotating over and across to the wrist. So the ulna traveling through here, The radius starts always on the outside and then ends on the inside. So right now, radius is crossing over the ulna. This side of the wrist is the ulna, and then we see it again over here. So it's coming across here. Radius is doing that. But if I turn my arm over, the radius rotates back to more parallel. The ulna is right through here. The radius is right here. One of the secrets, and we can't see this in the drawing because we can't really see his hand though, is that the radius always follows the thumb. So if I have it turned this way, you can see how my wrist rotates over. This point right here is the radius rolling over the ulna. And that's what's causing some of this right here, if you can see that shadow. The bump on your elbow, right here, is the what's it called? Oh, hold on. Okay, I had to get the pronunciation right. It's the olecranon, and that point of your elbow is actually part of the ulna. So it's this piece that sweeps around here and then heads down. So whenever you can see that pointing out, it's this bone rotating into the facets of the humerus. And the humerus, of course, is why we get the name the funny bone, because it's funny when you get hit there. So recap again, cranium, brow ridge, really important. The orbit sits back inside that space, so it's pushed in. That's why the eye sits back into the skull. The zygomatic arch, always catching light, your cheekbone. Following the line of the mandible to get the line of the jaw. And then the corner at the base of the cranium. 7 vertebrae for the neck. The big bump is C7, cervical 7. You've got the clavicle coming up here, creating the acromion process, which is that bump. Clavicle going off this way, we can't see what it does back there. First rib coming and attaching to this top piece of the sternum. Sternum coming down, creating the end of the rib cage, the ribs falling away, and defining the shape of the rest of the chest in here. We got the iliac crest, or the crest of the pelvis. And then we've got the ASIS, the anterior superior iliac spines, which is where all of the muscles of the leg are going to attach, as we'll learn. We've got the great trochanter pushing out and becoming the femur, dropping down, the wide boxiness of the femur and the head of the tibia, the patella sitting on top, the fibula coming down, jutting out, making a little bump right here that we can usually see, and then coming down and creating the outer ankle. We've got the head of the humerus up here, the length of the humerus coming down, and then the tibia, the radius and the ulna. And the ulna making that point where the elbow point is. The radius, sometimes we can see a little bump there, but remember it's rotating over, and that's its job in this case.